Hi, I'm Dr. YVRao, plastic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today I'll be operating on a patient of 60 plus years for hair transplantation. In this context, I'd like to discuss a point about, or rather demystify about a myth. That is, most of the times people ask that one or are under the impression that when hair transplantation or any other cosmetic surgery is only for the young, but it's not so. It can be done to any age patient as long as we are medically fit. I have done for patients who have got the even bypass done or even with the stents also, and those who are on anticoagulants also. Sometimes we reduce the dose, but we don't even stop the anticoagulants also. So there are certain a few precautions that we take in elderly persons, or rather above 60s, or who have undergone the surgeries. In fact, I did even for a patient who got this kidney transplantation also done, and those who are on immunosuppressants also. So they were all successful. And as long as one is medically fit, one can get this surgery done, even at the age of 60 or even age doesn't matter here. The second point which matters that are slight differences between a hair transplant in a younger patient and in elderly patients is, in elderly patients, we don't concentrate on density. We rather concentrate on extent of the hair transplanted area. Whereas in younger patients, when the hair transplantation is only limited to certain areas, we try to concentrate more, giving more number of hairs in a small area. Whereas in elderly patients, as we keep aging, the way it should be a graceful balding pattern. So we give coverage all over the entire area rather than giving density in one particular area. That's another difference that we follow.